Good morning. This is All India Radio, Kohima. The morning news are read by Jonas Yantan. A total of 14 persons tested positive for COVID-19 out of 57 samples collected during the random sampling and testing exercise conducted by Kohima District Task Force on COVID-19. Informing this, Chief Medical Officer Kohima, Dr. Vezakola Teo, yesterday said random test was conducted to study prevalence of COVID virus among the public in Kohima. The exercise was conducted at 3 locations, AG Colony, Paramedical and Minister's Hill, Kohima, on 28 and 29 April 2021, where the random samples were collected from amongst the public. The liberalized and accelerated Phase 3 of the COVID-19 vaccination drive starts today. Everyone above the age of 18 years will be administered the COVID-19 vaccine in this phase. The registration process for this phase is underway and over 2.66 crore people have registered on the CoWIN portal so far. In this phase, the vaccination will continue as before in the central government's vaccination centres free of cost to the eligible population, including healthcare workers, frontline workers and all people above 45 years of age. During this phase, vaccine manufacturers will supply 50% of their monthly released doses to the central government, and they will be free to supply the remaining 50% doses to states as well as in the open market. In Nagaland, the Health Department said vaccination of the age group 18 and 44 years will commence only when the state receives vaccine from the supplier. The Office of the Principal Scientific Advisor to the Government of India has released home care tips for managing mild symptoms of COVID-19. It has advised people not to panic if they experience any COVID-19 symptoms, as the majority of people can manage their infections at home by following self-care measures. They have been recommended that at the first sign of experiencing the symptoms, people should isolate at home and begin following self-care measures. It is important to isolate, rest and keep hydrated, and regularly monitor the patient's blood oxygen levels and temperature. The patient has to consult a doctor if the fever persists or if SpO2 levels fall below 92%. The guidance also highlights the importance of keeping the patient's doors and windows open to keep the room well ventilated. It outlines the importance of getting vaccinated to reduce the spread of the virus. It also reminds people that even after being vaccinated, it is essential to continue to follow COVID-appropriate behavior. Nagaland Deputy Chief Minister Y. Bulletin, on behalf of the state BJP legislators, has congratulated the new team of Naga Students Federation, NSF, led by its president-elect, Keong Tep. Bulletin said NSF has been vocal for the welfare of the students' community since its inception, and that NSF also plays a proactive role representing the students in crucial issues pertaining to the society. He expressed hope that a new team will shoulder the responsibilities of the students' community with utmost sincerity and dedication. Bulletin hoped that the team will carry forward the aspirations and visions of the pioneers for a unified and glory of the people. Nagaland reported 4 more COVID deaths from Dimapur district yesterday, taking the toll to 94. So far, Dimapur alone has reported a total of 72 COVID mortality, which is the highest among the districts in the state. Out of 7,711 cases reported from Dimapur, a total of 6,385 infected persons have recovered. Kohima so far reported 4,328 positive cases, out of which 4,023 have recovered and 22 COVID deaths reported. And as the number of COVID cases are on the rise, we appeal to our listeners to take all the precautions and all those above 18 years of age to get vaccinated without any hesitation. The vaccination for the persons of ages between 18 and 44 begins today at designated facilities. Stay safe and protected by following these 3 simple steps. Wear a face mask, focus on hand and face hygiene, and maintain a distance of 2 yards for social distancing. With that, we come to the end of the morning news. Have a nice day.